Chair, Mr. Speaker. There's no doubt that the opioid crisis unfolding right now in our communities, big and small, right across Canada, is nothing short of a national emergency. The suffering and damage this crisis is causing, not just in Vancouver's downtown east side, the epicenter for the crisis, but in Vancouver East and cities across British Columbia and Canada, and it is absolutely devastating. I'm very grateful for the Herculean efforts of first responders, frontline workers, medical practitioners, family members, advocates, and activists who have and are continuing to work tirelessly to save lives in the midst of this terrible crisis. Honourable Speaker, people are dying in our communities. Both the City of Vancouver's Medical Health Officer, Dr. Patricia Daly, and the Provincial Medical Health Officer, Dr. Perry Kendall, have declared this crisis as a medical health emergency. In fact, this is the first time in the history of British Columbia that a health emergency was declared. It was noted by Dr. David Jerlink, head of the Clinical Pharmacological and Toxicology at the Sunnybrook Health Sciences Centre in Toronto, that the number of overdose deaths across Canada vastly outpaced the toll during the 2003 SARS crisis that gripped this country and was declared as an emergency by the Ontario government. He stated, and I quote, 44 people died of SARS. We lose 70 people a week to opioids in Canada, end quote. Still, the Federal Minister of Health has refused to declare this as a national health emergency. From the beginning of 2016 to October 2016, 338 Albertans died from an apparent drug overdose related to opioids. Fentanyl was involved in 193 of them. 2 Ontarians died from opioid overdose a day. An average of 79 people die of drug overdoses every year in Montreal. If this is not a national health emergency, Mr. Speaker, I don't know what is. So today, I'm here once again urging the government to do what is right and what is necessary. Declare a national public health emergency. And let us remember, as we debate Bill 37, people in communities across the country are still dying. Bill C-37 came on the heels of an announcement from the BC government, who was no longer willing to wait for the federal approval and decided that it would take, quote, the extraordinary measure, end quote, of signing a ministerial order in making the provincial operation of temporary overdose prevention sites legal. For those who want to put up roadblocks for harm reduction initiatives, including supervised injection facilities, I say this. It's been more than a decade since Insight, the first supervised injection facility in North America, was established. There has not been one single overdose death in that facility. Insight has saved countless lives. It has reduced the spread of diseases. The evidence is clear and it is unrefutable. Van East led the way, and I am so proud of the progressive forces and the movement in our community that care so deeply, that took this issue and drove it until we had the first supervised injection facility in North America. I still recall vividly, Mr. Speaker, the imagery of 1,000 crosses planted in Oppenheimer Park, in our community, what we call the killing fields. And each one of those crosses bared a name of a real person that we know that we love in our community, a daughter, a son, an aunt, an uncle, somebody's children. And how family and friends came together and we mourned the loss of those preventable deaths. It was a call to action, and we drove the issue, and eventually Insight was established. It's sad to me that despite this irrefutable evidence-based outcome, there are still those who want to block this critical health measure. The former government took every step possible to undermine the work of Insight. Even after the Supreme Court of Canada's decision, a 9-0 decision that ordered the government to exempt Insight from prosecution and stated clearly that the government cannot close Insight because of its ideology. The Harper government passed Bill C-2, the ill-named Respect for Communities Act, which introduced near insurmountable barriers to opening new supervised injection sites in Canada. The roadblocks have been widely condemned and have no doubt contributed to preventable deaths. Though with more than a year of foot dragging and thousands of overdoses and hundreds of needless deaths, the Liberal government today is finally bringing in measures to address the ideological relic of the years past. While I support Bill C-37, to be clear, I would much rather that the bill was about repealing Bill C-2. But nonetheless, this is a move in the right direction. It's a step forward, so I am here to support it. Bill C-37 has to get through this House, then it has to be sent to committee, and then it has to go to the Senate. It'll be some time before this bill passes. So I want to applaud, first of all, my colleague, the member for Vancouver Kingsway, the NDP's critic for health, his attempt to try to get this bill through all stages as quickly as possible. Sadly, that proposal was rejected. Many concerned citizens and organizers are so frustrated by the glaring absences of substantive action on this that they have felt compelled to act unilaterally with pop-up supervised injection sites. Extraordinary times call for extraordinary measures. This is a testament to those individuals' courage and dedication to saving lives in our community. Let me take a moment and to thank them and to acknowledge the numerous volunteers and activists, the leadership shown by Ann Livingston and the peers at Van Du, Sarah Blythe, the former Vancouver Park Board Chair, and many, many others for their incredible dedication and caring. Were it not for their efforts, I can say with confidence that many, many more people would have died. In going forward, Mr. Speaker, as we wait for Bill C-37 become law, what action can be taken to save lives? Let me start with a shout out to all the tireless first responders for their incredible efforts. I heard firsthand from firefighters about their experiences in this crisis, particularly those men and women who are in Fire Hall number 2. The incredible overload of calls that came into that hall and the stresses that the firefighters had to face with each and every day, that they have to witness deaths. Imagine that as their work each and every single day. And then, as you know, Mr. Speaker, it is not limited to Fire Hall number 2 in my riding. In fact, all the other fire halls in my community across East Van had an increase in calls with respect to overdose challenges and issues. I heard from firefighters who told me that within their own shift, that sometimes they would have 2 or 3 or 4 or more calls going out trying to save lives. That's what they're faced with. Imagine the stresses of that, Mr. Speaker. The BC Coalition of Nursing Associations hosted an emergency forum on the nursing response to the opioid crisis. Like so many, they are devastated by this medical health emergency, and they themselves are suffering from stress, trauma, and exhaustion. All first responders, nurses, healthcare workers at emergency rooms, frontline workers with NGOs, they are overextended and they deserve our support. While the Minister of Health has said that they would take action and provide support to first responders, we are still waiting. Let's get on with it, Mr. Speaker. As well, I want to say that we need to do much more. Other issues as well is that we need to move to a longer-term resolution. Real effort needs to be made to provide addiction treatment. For some, traditional treatment works. For others, not so much. And we need to move forward with providing treatment that deals with the addiction, including opioid prescription and opioid substitutes. The goal of stabilizing people and getting them away from the illegal market saves lives. We also need to look at the issues around social determinants of health. We need safe, secure, affordable housing. We need to address poverty. We need to look at the issue of breaking that cycle. And we need to address Aboriginal child apprehension, a comprehensive approach so that we can move forward once and for all to save lives. Thank you, Mr. Speaker.
Questions and comments?